Hello, I am Dr. Carey. I'm a pediatrician in Ventura, California, and this is Dr. Carey's Baby Care. Today I have Jennifer, and we will be talking about gastroesophageal reflux and her 7-week-old Deaglin, who has had really a lot of discomfort from early on. 7 weeks old now, correct?
Yes, he's 7 weeks old.
Oh my, and it goes fast, doesn't it?
Yes, very.
But he was really in discomfort from an early age.
From the very beginning.
Tell me about this.
Just in the hospital, even when he came out, we had issues. He was spitting up, and they told us right away to burp him several times and keep him held up. But we didn't quite see the pain that had caused him until a little bit after that.
How long afterwards?
Probably about a week old, we started noticing things just weren't right, and started making changes, and we're kind of moving to maybe just colicky issues. Thinking, but more and more started happening, and it started to realize things.
Was he breastfed or bottle fed at this point?
Both.
Both?
Yes.
And did it matter whether it was breastfeeding or bottle feeding that made a difference?
There was no change if there was breastfeeding or bottle feeding, because that was one thing that I was looking at.
So we go from a baby who seemed a little bit fussy, and by 1 week of age, really
extremely fussy.
And in what way? What exactly was Deaglin doing?
He was crying consistently. He was stretching, arching his neck, turning his head from side to side. He would have very, I call them wet burps, and he'd often spit up. Soon formula or breast milk would start dripping out of his nose. While feeding him, it would come out then. It would come out an hour later, 2 hours later.
Right.
And it was more the pain you could hear in his cry, but it was just a consistent, fussy crying. He would, and you could tell he was in pain.
Right. And we made sure at that point that we weren't overstuffing, because really a common problem with children early on who are uncomfortable is they are getting, especially when bottle fed, getting way too much. But we stuck in the 2 to 3 ounce every 2 to 3 hour range,
Correct.
didn't we?
Yeah, we kept tight to that. Even when it seemed like he wanted more, we kept tight to it.
Was he more pain in the daytime or nighttime or when sleeping, or?
It seemed like more in the evening and during the night. But it was consistent throughout the day, but it seemed worse in the evenings, especially about 6 to 7 o'clock at night. It got worse, and then all through the night. And I don't know if he just wore himself out at that point, but it was definitely worse in the evenings in the middle of the night.
So now we come to the pediatrician because you're pulling out your hair. Prior to that, did you try switching formulas or doing anything?
Tried switching formulas. We changed 3 different formulas, all Infamils.
Okay.
But we also changed from the powder to the liquid, because I had read and been told that the liquid was easier for them to digest than mixing up the powder itself. We tried everything, and every time we'd notice a little bit of a change, but it really wouldn't be anything.
You know, it's funny with that. I have heard time and time again from parents that they notice a difference from the liquid to the powder, from the liquid to the powder. You speak to the manufacturer, they say there is no difference. You read everything, there's no difference, and yet I will hear parents say that often, and I'm always confounded by it. I really don't know what to make of it.
For us, what we felt, in our own opinion, is that when we would mix it, it didn't break down as much, and there would be a lot more bubbles, even though we would get them out of the bottle and we would do everything. I don't think it broke down quite as much, as the liquid had already been mixed and preformed and set in that range. And there wasn't as much, when we'd pour it in, there wouldn't be as much bubbles, even when we shook it around and everything, than there was when we would use the water. And it was always purified water, and But so I think for us it was that. Whether it was just gas issues because of it or not, I'm not sure.
Now, to relieve the pain, we started Deaglin on an H2 blocker that helps reduce the acid in the stomach.
Yes.
to hopefully reduce the amount of pain from any reflux or spitting up that he may be having. How did that work at first?
At first it helped slightly. We could see a change. It wasn't what we were hoping for. He was still having pain. He was still doing the stretching of the neck and the screaming, although the screams weren't quite as shrill. He was better, but he still wasn't great. But it did make a little bit of a difference, and we could see his personality starting to come out more because he wasn't in pain as much.
Right.
But we were waiting that week because it takes about a week to get in, and it didn't really change. It just kind of stayed that slightly better. And then at 1 week, it just stopped.
Right.
And we kept going with the medicine, but it was like we weren't giving him anything. And so we called the doctor right away.
And then next, they did a study.
Yes.
And my understanding is we did the upper GI.
We were sent in for an upper GI.
And again, that's a test in which some type of contrast material is swallowed. And how did they do that? What was it like at the radiology place?
It was actually really simple. We were a little nervous about it. And we went there, and they were very kind. And we took a bottle, and they put the barium in the bottle. And they prefer the fathers or not the mother to go in with the baby because of the radiation.
Okay.
So forewarning. So
Dad will be fine.
Dad went
it.
Dad went in with Deaglin, and they actually had him not feed him it until they had everything set. So once all the x-rays were put, like the machines were put in the right, they had him feed him the bottle. And then as they instructed him what way to turn him, whether it be at what angle, why they were feeding him. And then it was very quick, and they said, okay, we got what we needed, and it was done. And it was very quick.
And they used the same bottle you used?
Yeah, we brought in our own bottle.
Did they have to make the nipple wider?
Yeah, I told them go ahead and make the nipple bigger because the barium is quite thick. And so they just sliced the top, and then I threw away the nipple after because he can't have it that fast.
Right.
But it was fine. And he didn't even end up drinking that much of it. It showed right away. So they don't have to drink the barium and then do the test. They simply want to see him drinking it, and it happened.
Okay. And that's a really good initial test to take a look and make sure that there's no obstruction or anything else. There are some more subtle things that you cannot see with that. And the radiologist often says, oh, well, you saw some reflux in the process. But really, that doesn't tell you much because you don't know whether it's clinically significant or not, and how much it is, or whether that's causing the pain or not. So we did the test, and everything was normal. And then we increased the amounts of the H2 blocker.
Yes.
And then what happened at that point?
Things got better. They got better rather quickly, and we were pleased. We weren't having those same crying spells. He wasn't stretching the neck and straining, and the spitting up pretty much stopped. A little bit here and there, but it pretty much stopped. Life was getting back to normal with a baby. He no longer had what we thought was colic. And we were gaining our sanity back, and he was becoming more relaxed. And it was nice. It
was. That's
was
the operative
nice.
word. So now, what went from there?
We're starting to see things starting to come back again. We're seeing the spit up coming back, how he's doing it. We're seeing him starting to have pain. He's coughing a lot. He is choking a little bit when it's coming back up. We're seeing him, he tends to play with his formula, like it comes back in his mouth, and we tend to see him kind of chew on it a little bit. We're seeing that happen almost every feeding again. And we're still sitting him up, doing the burp halfway. He burps very well, but it's slowly starting to come back. He's getting fussier again. We haven't had anything come out of the nostrils yet, but I'm just kind of waiting. But the spit up is coming more and more each time.
Right.
And so we're at that point now. That's just where we're at now.
There certainly, dosing of medication changes very fast for little babies because they're gaining weight very quickly, and it's always important to know that we're on the right amount of medication and whether that's happening or not. But there comes a point also where we're really showing that much discomfort and having that much of a problem, it really becomes time, and it's going to be time for you to see a pediatric gastroenterologist also, so they can take a little bit further look, because there are studies that the gastroenterologist can do that the pediatrician doesn't have the equipment to do. One, they can do what's called a pH probe, which is a strip sensor that goes in the nose and down into the stomach, and as the baby spits up, they can get a gauge for how many events are happening over a period of time, how high that spit up is going, how acidic it is, and get a feel for whether the perceived discomfort in your baby is correlated with that spit up, because one could be uncomfortable, one could be spitting up, but are the two necessarily related, or is there something else going on? Certainly with all of the arching, it makes one consider the diagnosis of Sandifer's syndrome, which is often mimics a seizure-like event, and then one needs to know whether it's just from the spitting up that we're uncomfortable, or there's a neurologic issue that needs to go on, which is very unlikely. Most of the time it's just spitting up and they're really uncomfortable. The good news is down the road, this does eventually get better. It just doesn't feel like it now, does it?
No.
Mm-hmm. And you have 2 other children.
Yes.
And how old are they now?
10 and a half and 7 and a half.
Okay. And their names?
Xander and Hayden.
Xander and Hayden. And they, were they spitty, his children?
Neither were spitty, had problems, and
Nothing
they both
at all.
got the breast milk and the formula, and no, they were great.
So you get your 3rd one, and then suddenly we're in discomfort.
Yes.
And down the road, he will get to that point also. It just doesn't feel like it now.
No.
Because part of the problem is that the muscles over the diaphragm are very weak, and we tend to spit up because of that as infants. But by a year of age, those muscles start to tighten up, and once those muscles tighten up, food is less likely to come out. And about 90% of children by 1 year of age, this completely resolves. There's always a handful who linger on till about 1.5 years to 2 years of age, but even in most instances, they finally get better. But I've stopped telling parents, oh, at 1 year it will be gone, because there's, 1 out of 10 is going to prove me wrong every single time, and we'll go from there. So that's our story at this point. We have a child who's uncomfortable, started to get better with medications, moved a little bit backwards, upped the dose, got better again, starting to move backwards, and really there comes a point where a specialist needs to take a look, and we need to go from there. And with that cliffhanger, Jennifer, I really appreciate you coming out and talking about this. That was really informative for people to get an idea of, it's not always clear-cut what happens with reflux.
Correct.
And again, thank you very much for joining us. I am Dr. Carey. For more baby care information and to join our mailing list, please come to drcareys.com. And at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ears.